one day I was about to go to work and I thought, oh, I don't know if I can go in there, I'll have to take this medication. And this wild moment came over me and said, you should not have to take anxiety medication to show up at work. You are not supposed to be here. So my body has always told me that, no, this is not quite the right spot for you. You need to make an adjustment here. And so I do honestly believe that is what has led me to be in this role, because we're not broken, we're not doing things wrong. We're just not quite in line with what our soul truly wants us to go for. We just squash down to the deepest level what is so important to us. And our body will let us know when we're not honoring it.
So the big question is this. We know spontaneous remissions and so-called miracle cures exist. We also know they aren't so spontaneous after all. I'm living proof of this, having cured my quote-unquote incurable illness. There's something to how this happens. So how do we, as humans with chronic symptoms, tap into this so-called miraculous healing capacity? That is the question, and this podcast will give you the answers. My name is Dr. Erin Hayford, and welcome to the Sacred Illness Podcast. Before we begin today's episode, just my standard medical disclaimer. This podcast is intended for educational and informational purposes only. The content should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare professional regarding any medical concerns. Hi, everyone. Welcome back to another episode of the Sacred Illness Podcast. I'm Dr. Erin Hayford. I'm your host. And I today have a lovely guest with me in Adelaide, South Australia. My guest's name is Renee, the massage therapist, here to tell us a lot about the experiences that she has with folks on the massage table, the things that women are carrying in their bodies, how these amazing emotional releases can happen. That is going to be interwoven with Renee's personal story. So we have a really beautiful conversation in store. Thank you for being here today. Renee, I'm so excited to chat with you.
Thank you so much for having me. I'm thrilled to be here.
Absolutely. So wherever you'd like to start, whether with your story or with some professional anecdotes from your experience, where would you like to kick us off today?
All right. I think I might share how I came into the work that I do. I had a little bit of a light bulb moment when I was preparing for the podcast. I realized that a lot of the work that I do really intertwines with the experience that I've had myself, but I've only just recently made this discovery. I'm an energy healing massage therapist. So essentially what I do is I bring awareness to the client on the table. I connect the physical elements to the energetic body and let the client know what their body is storing. And as a massage therapist, I'm shifting it along to make them feel lighter in their body and free up their body, allowing them to carry the emotional weight better of life. But it's a lot more than that. And I don't think I quite realized what really it was until, unpicked it all. So coming in as a massage therapist in my career was really quite unexpected. I didn't really have a relationship with massage before I became a massage therapist, and I'd only really had a handful of massages prior. But I did have one massage that was what I truly believe an energetic massage, which I didn't realize at the time, but it was one of those massages that was memorable to this day. I still remember how I felt after that massage. And anyone listening and who goes to get massages would know that some stand out more than others. And this massage was one of those really memorable ones. When I got off the table, I felt alive. I felt like a spark had been reignited, and I just didn't even know I needed that spark reignited. I just felt so motivated and inspired, and I was just untouchable. It was just this incredible feeling. So
Wow.
The massage therapist was clearly a healer, and I didn't realize this until later down the track. It was actually about a year later after this massage that I had was when I decided to resign from my stable employment where I was getting a weekly paycheck. I decided to just throw it all in and train to be a massage therapist. And as much as it surprised me, it surprised all my friends and family around me because, I just did not have any relationship with massage prior to this. It really came out of the blue. And when clients often ask me on the massage table, how did I come to be a massage therapist, which I get asked a lot, I often just say that I feel like I was picked up and put here. That's really the only way that I can describe that experience. So I undertook all my training and I specifically lined myself up to be a pregnancy massage therapist. I was never interested in sports massage or that really hard, firm massage that we all know. I think I was very drawn to the nurturing side of a pregnancy massage, but it wasn't long after working with pregnant women that I started to work with pregnancy loss and pregnancy beyond loss. And that really opened the gates for me to work with a lot of clients who were dealing with grief. About 2 years after starting my massage business, I had a personal experience that changed me forever. I've got 3 children, and my second child, who was 11 at the time, he had a medical surgery that it was about a 2-year adventure and it had a profound effect on me. It was the first time I fully experienced grief. Right. And I thought grief was something that only happened when someone close to you dies. And yeah, this really taught me a lot about how we hold it in our bodies, how it impacts so much. And I think that was just another turning point for me where I realized that my work was a lot deeper than I first realized that it was. Right. So after I decided to get back into work, after I got over this medical journey, my body seems to have this way of telling me when I'm not in alignment. And I was getting to that point again where I was starting to feel completely burnt out. And many times when I've got a client on the massage table, even prior to my son's medical experience, I would get snippets of information about a client who's laying on my table. And I didn't have enough trust in myself and I didn't perhaps quite understand it. So I used to think that I was obviously just making up stories about these clients while they were laying in front of me. But I never wanted to say anything to the client on the table because I was unsure of how it would be received. But I started to realize that I was in a bit of a predicament where I was starting to burn out at work and I wasn't feeling this fulfillment, which I was really seeking in my work. And it was really a call for me to think, okay, Renee, you have got to start being you, the real you. You have to show up as you at work if you want this to work and you want to see this fulfillment. So I did. I started to talk about what came up for me and I would raise it with the client. And it was just amazing to think that, wow, they actually could resonate with what I was talking about. This isn't something that I've ever trained in. And so I didn't really know what I was doing, to be completely honest. I think that's what this surgery for my son did. There were no rule books for how to handle his recovery. We were a little bit of a guinea pig in this situation. So I had to sense and really feel into how we were moving forward. And I really had to take that tool into my work. I had to really feel into my work and sense and just really let myself relax into it. I think previously when I first started as a massage therapist, I just wanted to be the best massage therapist and I didn't want to make any mistakes. And so I was very much in my head and I was not in my body. And so that's been the real difference in my work. The more I can sink into my body, the more I can really do what I'm supposed to be here for. So that's how it all really began. I start sharing the wisdom that I receive, and I often get bodily sensations when I feel that I've shifted that energy. And again, I probably got that many years before, but I was so disconnected from my body that I didn't allow myself to make that connection. And it's really just the most fulfilling work because I get so many women come in and they just know they're not feeling right and they just don't really know what to do next. And so if I can give them some form of insight as to what might be a clue to what their body is saying, it just feels like the greatest gift and they've got the opportunity to do something about it. So that's about it in a nutshell.
Amazing. It's so inspiring to me to think about how we get onto our path. So often the folks that I talk to are saying the reason they're doing the work they're doing, myself included, is because something happens that's not so positive, like an illness or an injury. Kudos to you for hearing it and following it. And I didn't write it down exactly as you said it, but something along the lines of the more I was in my body, the more aligned I became with my purpose, which to me is everything. If I had a motto for my work, it would be something along those lines. That's the core tenet of sacred illness and of anyone on a healing journey is the more embodied you become, the more you find your path and find your purpose, and the more you heal can relate to that. Because I used to do the typical naturopathic stuff and I was very heady, playing by the rules. This symptom equals this lab equals this supplement. And initially it was fulfilling, but then I got to this point of it feeling unfulfilling because even though I was successful, I knew there was more. I was like, I can sense in my body, I can feel when these people are in the room with me. I can know there's like an elephant in the room. I can sense it. I can feel the blockages. I can feel the emotions. I can feel what's happening. And I knew from my own healing journey that what healed me was not supplements. It was the mind body work that I did. So I started to just go with it and figure out what that meant. And a lot of what I do is from my training, but more so from what comes forward when I'm literally just in my body and trusting what is happening. And that's what has made my work so fulfilling. Do you feel that's who you have always been? Have you always had an intuitive connection, or is that developing more slowly over time?
I think I've always been, but I do also believe it's developing over time. I'll give you an example. I was in a workplace at one point and I just knew it wasn't right for me, but it was such an exciting opportunity and I knew everyone around me was so excited about it. So I felt it must be so good. I should take this job. And I did. But I had a deep knowing it wasn't quite right for me. And then my body let me know all about it. I experienced my first ever panic attack. I've never had a panic attack before. And I thought, this is not normal. I ended up leaving that job and never had another issue with a panic attack. But then I've had various other jobs where I've felt quite stable. And then I had another role where I started to feel very anxious and I was diagnosed with anxiety and depression and I was given medication for anxiety. One day I was about to go to work and I thought, I don't know if I can go in there, I'll have to take this medication. And this wild moment came over me and said, you should not have to take anxiety medication to show up at work. You are not supposed to be here. So my body has always told me that, no, this is not quite the right spot for you. You need to make an adjustment here. And so I do honestly believe that is what has led me to be in this role, because we're not broken. We're not doing things wrong. We're just not quite in line with what our soul truly wants us to go for. And we so often put everyone else's, especially women, because I work a lot with women, we so naturally want to put everybody else's needs in front of our own. And we just squash down to the deepest level of what is so important to us. And our body will let us know when we're not honoring it. So I get to see this every day with women, and it's obviously the client's choice whether they want to take that advice on board. But in my personal experience, I know I've been to healers before and they've told me snippets of information, which at the time felt like just a sentence. It didn't mean too much to me. But then years later, I'm like, that healer told me this.
Yeah.
It's really important for me to do this in my life. And I'm like, oh, she was right. But I took that on 5 years later. So I also have that compassion for whoever's on my table, that the information I give them today may not be useful to them today. It might serve them far down the track. It might not even serve them. They might choose to not do anything about it.
Yeah, 100%. I'm wondering if you have a sense too, because sometimes I have that intuition too of what I'm telling someone, they need to hear it now, but it's not for now. Do you get a sense people sometimes
Yes.
do? Yeah.
Absolutely.
Yeah. And it's seeds planted, right? That's part of my own evolution in this work too, because I came from the mindset of I'm a doctor, therefore I'm the one healing the person and giving them the stuff and it's my job. And I had to very quickly move out of that because that mindset alone will burn you out and is not healing. That is not a healing mindset, which is part of the problem of our medical system, but that's a whole other conversation. I had to move into the mindset of I think of myself as a guide. You're on a journey. I'm here just to ping you along in your journey by giving you certain information and certain insights. And some of those seeds will be planted today in your journey, and some of those you carry with you. And like you said, sometimes they never get planted. Sometimes they get dropped, whatever. But it's that idea of giving that information, and then it's the person's journey to figure out where and how and when they fit in. And I want to shout this from the rooftops of what we're saying about illness being this clear sign of or call for redirection. Obviously, we all across the world, you're in Australia, I'm in the US, it's the same everywhere, that the cultural conditioning is like, oh, I have anxiety, I need to take a medication so that I can keep doing the job. And exactly what you said, it's this call of no, you have the anxiety because of the job. The anxiety is trying to stop you from doing the job. The body is the intelligent voice here. It's stopping you for a reason. And I understand why we are frustrated with that or hate that. We don't want to get stopped in our tracks. But that's the whole point of this podcast and this work that you are doing and I am doing, is just create this paradigm shift of it sucks and it's not the end of your life. It's actually this invitation for you to step onto a new path into the more fuller expression of who you are. So I'd love to hear some stories of people you've worked with, experiences you've had as you lay hands on folks, work with them, however you want to share it with us.
Yeah, absolutely. So people will tend to book in for a massage because they've got a physical ailment. So they might have, because I see a lot of pregnancy clients, they'll have sore hips, or people who are working in the office, they'll complain of their sore neck and shoulders. So they're often coming in because they feel something physical. They don't feel quite as good in their body as they could. And so what I will do is I'll have a consult with them and I'll talk about how is the body feeling, and we'll make a treatment plan around what it is that they want to have worked on that day. And it's usually when I'm working in that area, or sometimes if I get a feeling that, because I have, through my work, I've realized that certain things sit in certain areas of the body. So if they start to say to me, they're feeling really unsettled about moving house, for example, but they'll say, but it's only my back that I'm feeling it. I would probably insist, I would really like to work in your legs, because legs show a lot of how we're feeling unstable and our foundation feels a bit rocky. So we often feel that in our legs. And clients will often say, while their legs don't complain to them, after the massage, they will notice how much of a difference they can see. So this is the tricky part. Some parts of the body will really scream loud and others not so much. And the ones that don't scream as much, I think, really give that feeling of just feeling heavy and just weighed down with life. It shows up in different ways. But some of the examples that I would see, a fear, for example, sits very much in the hips. And many pregnant clients will come to me and say, you know what, I've got a sore low back and sore hips, but that's really normal because our society has taught us that we need to look for physical things as to why we feel the pain, and that will give us our answers. And I've always had the belief that we need to look at the emotional things as to why we're feeling the way we are. And yes, physical things absolutely do impact the physical body, but so do the emotional events in our life. I'll massage their hips. There's a lot of fear there, and it's always different fear. So it might be fear of giving birth and not knowing how to, because it's a first time experience. There's also fear of giving birth and hoping it's going to be okay because the last pregnancy was not. We carry all of this in our body. I remember massaging one client one day. She was also pregnant with hip pain, and I got to one hip and I said, have you got some concern about finances? I feel there's they worrying you about finances. And she just started crying and she said, my husband and I have decided not to stay together after this baby is born. And she just didn't know what life was going to look like after the baby was born. Of course, we hold these things in our body. When we don't have the answers and we don't have a strategy for it, it's got nowhere to go. So it holds in the body. I've had a postnatal woman come in and she was showing some signs of grief, and she's very happy with a new baby and she's very grateful, of course. But the part that showed up for her was that she is really missing the social connection that she would get from being amongst life when she didn't have to be at home tending to her baby. And don't get me wrong, she wants to be at home tending to her baby, but the social interaction is a huge, important energy flow. She needs to be connecting with people. So my advice to her was that she needs to make sure she incorporates social interactions while she is on. So yeah, what I will try to do is I'll try to explain to them what it is that's there. I might ask to clarify so that they can understand what the awareness is, but we don't generally then talk about it a lot. It's not therapy. I'm just bringing that awareness to them. And then if I try very hard to then give them some help as to what they as an individual can do to shift that energy, because it is a very individual thing. There is not one thing that is going to help everybody shift their energy. I could tell every client I see that keeping a journal and writing down how you feel every day is going to shift the energy. It will for some, but it won't for others. So if I can get a piece of information that will help them, for example, the postnatal client who needs to keep that social interaction up in her life despite not going to the workplace every day or however it is that it used to show up for her. These are the pieces of information that I give them to give them something that they can take away with and use to help them keep their energy and flow so that they don't feel so weighed down.
Beautiful.
Yeah.
Yes, I know. It would be so easy if it was like, once you name it, somehow there's just a universal thing that you then do with it. But it's such a, all of it is unique. What you're holding and how you're holding and what you do with it. But we don't know what we need to work on until we know what it is. The thing I always say when I'm working with people, so many of us know we can look at our lives and fairly well say, these are the major stressors in my life. These are the major traumas that I've had. We all usually have a good idea of, if we are aware of this mind-body connection and understand that maybe we're holding something in our body. I think a lot of us could say, oh, it's probably from this event or this thing or whatever. But what I find, and I'd be curious to hear if this is your experience too, is as I'm working with people, we get this specific thing. It's a more specific thing than just, I had childhood trauma from my parents. It's this specific story or specific emotion. Whenever you're working with the body, it helps you hone in with more detail. And or helps the emotions come out that might be locked there. Because as we know, it's important to understand about trauma and about the things that make us who we are and what contributed to our lives and all that kind of thing. But somatic work of any kind, you can really hone in on what actually the body is holding in that spot.
Yeah. And I think because we have behaved the way that we do, we live our lives because it is so normal to us. We don't realize that the actual behaviors that we're doing can be changed or are hindering our progress.
Yes.
I'll give you an example of one woman who had a lot of congestion in her upper back, neck and shoulders. And that typically shows to me that they take on a lot of responsibilities. They've got a lot of pressure on them. And when I raised this with the client, she's, yes, I know, there's nothing I can do about it. It was a real resistance. It was that I'm going to continue taking on, there is no other choice for me. And so really what it came down to was that she feels seen when she does a lot. So there was that attachment of, it's not just I need to do a lot to get through the day, but it shows my identity to other people. And so she just didn't have that awareness. So she knew that she does a lot and she's always burnt out. She's always running herself down. But she didn't realize that she had connected that to how people accept her and giving her self-worth. And so that's the ticket that she needed. She needed to then be able to identify in other situations when she goes about her life, when that returns, is she doing something that she is connecting to her self-worth? Is she doing this because she wants someone else to notice her because perhaps when she was younger, she didn't get the attention or the value that she felt she deserved? And so sometimes that is the missing piece that they need. Yeah.
100%. Yes, exactly that. Because it's that story of, I'm really busy. That's why my neck and back are sore, whatever that is. And it's interesting because it's just a slight tweak in perception of, yes, technically they're tense because you're so busy, but it's holding that reason why you think you have to be busy. It's that tension of, if I don't do this, I will not be loved. I will not be seen. I will not have purpose, whatever that is. That is the load it's carrying. And I had a similar client just this week where it was same thing, very busy. And her belief was, if I don't do it, the world will fall apart. No one will do it. I can't trust anyone. I can't rely on anyone. It's just me. And she was like, I know it's not true. I know my husband is wonderful. I could ask for help. But there was just, again, that childhood experience of, As a kid, it was true. She could only rely on herself, a heartbreaking situation of her childhood. And so I always try to validate that for people too, of whenever that story formed, it was true. It was your
Mhm.
reality. It was how you had to survive, what you had to do to get through. But now feel how this is in your body. It's not working anymore. This pain, this physical symptom, this diagnosis you've received is the signal to you that it's trying to stop you in your tracks and say, this is no longer you. This is no longer the life you're here to live. You're here to now grow past and evolve past that story so that you can step into whatever the next thing is for you. And sometimes the next thing is just not having that be an aspect of your life, right? It doesn't mean you have to blow up your life and move across the country and get a divorce. Sometimes it is, but sometimes it's just you trust people can help you, or you ask for help, or you believe that if you stop and rest, you still are loved and worthy, or whatever that is. So it doesn't have to be this massive shift. But yeah, you said that when there's no answers or no strategies, it's held in the body. To me, it was like a light bulb moment.
It's so true because when we don't know what to do with the energy, for example, grief, you can't eliminate it. It's
No.
happened and you're going to have to work with it rather than just getting rid of it. So it will stay in the body, but you don't know what to do with it because it's a tragedy. It fills you with so many feelings and really weighs you down. But you have to be able to know how you can move it because it's probably going to stay there for a really long time. Very rarely do we say, I've processed that grief and I can pop that to the side now. I can move on really freely in my life. It's more so learning, okay, my body is showing now that I'm feeling the weight of that grief this afternoon. And this is generally what my body likes for me to release it. May it be go for a walk out in the trees or go have a cup of coffee with someone who you really enjoy spending time with. It's just a matter of working out how you can shift it. It's a trial and error situation, really.
Yes, 100%.
Yeah.
And once you understand, oh, this is grief, this is where this lives in my body, just even that attunement, do you feel like that helps people start to figure out how to move it through?
Yes, and it's so empowering because you've got control over how you feel. You can accept that, yeah, I feel really shitty today because I'm really sad about this event that happened and it just happens to be affecting me today more than it did yesterday. So today I'm going to take a minute and I'm going to go and do something that shifts my energy. For example, there's a little spiritual shop local to me. And sometimes when I'm just feeling the weight of the world on my shoulders, I just need to go and visit that little spiritual shop. I have a look at their decks of cards and just the smell of the incense. And I just feel like I'm at home in that little shop. And so sometimes I'm like, you know what, today, Renee, we're going to go to the little spiritual shop. And so for me, that's one of my little ways of shifting energy. And so you start to get to know what works for you, and you've got a little repertoire of what you can choose from. And I think that's the way that we can move forward, understanding that what is going to clear my energy probably might not be suitable for you. What might work for someone else is not necessarily going to work for the person next to them. Yeah.
Absolutely. That's a top down to outside in approach, right? Where it's saying something outside of me is going to fix this and it will fix it for everyone. It's no different from saying this medication or this outside therapy or whatever is going to be the thing that fixes the problem and it will do the same thing for everyone. It's giving your power away to this external thing and thinking that's the solution. And as you're saying, it might be. However, we have to approach it from the inside out. If we tune into our body and get to know ourselves, then our body will lead us to what we need. I have worked with people where literally their body was like, that medication, that surgery. It's not always something quote unquote all natural. But I think that's where we have to, again, have a mindset shift where the body really is incredibly intelligent. And when we tune into our body, we're really just tuning into our higher self, our wisdom, our innate wisdom. And that's why I advocate so strongly for this mindset shift around illness, because it's not a failure. It's our innate wisdom manifesting in this particular form because it's been holding and working with and dealing with something and it's trying to get us to shift and call us in. And when we tune into that discomfort, that's where it directs us to what do you need to help to shift things. And I think it's so interesting how all these different somatic approaches get us to where we need to go. It doesn't matter if it's hands-on or talking to the body or whatever it is, the body holds that wisdom. And so if you're working through the body, it will get you there. And you had said something really important, which is that sometimes when people come in with back pain, when you put your hands on them or when you start working with them, you're drawn elsewhere in the body. That's why doing this kind of work is so important, because if we are just doing that sort of this symptom equals this treatment, this part of the body, this disease equals this treatment, we're missing where it might actually be originating from. And I just say that all the time with my clients as when we do our work together, that, okay, you have heartburn or you have back pain. We can go there first, but your body might take us elsewhere. And sometimes that's the case. It actually starts down here. It's in your heart or it's whatever.
Yeah, one particular client stands out to me where I said, I know this sounds really crazy. Sometimes I do think, what do they think of me? But you've just got to trust, because usually it pans out. She normally doesn't like to have her feet massaged. And I said, I just feel like I need to massage your feet today. Would you give me approval to massage your feet? And after the massage, she says, I've never had my feet massaged. I don't feel comfortable having my feet massaged, but I needed that. So she felt the difference afterwards, but obviously didn't feel it at the time. And her discomfort is typically always in her back, along her back and amongst her shoulder blades. But at this particular time, she was returning to work after having a baby, and she just didn't know how that was going to look. She had to organise childcare. She hadn't found the right childcare centre yet, and the date of her return was getting very close, and it was getting really stressful as to having all the dots line up. And so in that instance, it was her legs and feet that really needed that attention. And yeah, she personally couldn't feel that. It wasn't a symptom that she came in and said, please work on my legs today. But because of the information that I'd been given elsewhere, it led me down to including that area.
Yep. And it's also really fascinating what you said, how obviously we are more attuned to the more uncomfortable sensations and symptoms in our body, but how the body speaks through all kinds of different things. And sometimes they're not negative or unpleasant, right? Obviously, sometimes our body feels good and we tend to not notice that. But like heaviness is easier to ignore because it's just, oh, I'm tired or whatever. We can override those things. But that's part of this embodiment piece we're talking about. When you embody yourself and you're living in your body and you're just more attuned to your body, you can start to pick up on those subtler cues. Obviously, pain is the loudest, most obvious, hey, tune into me kind of symptom or signal. But there's other ways in which your body is trying to get your attention. And that's preventative medicine, is living in your body and listening to those subtler cues and starting to really trust, even if something feels slightly off or slightly not okay, listen to it. Your body is wise. It is not kidding. It's not lying to you. That's your higher wisdom, right? It's telling you this doesn't feel good. And even if it doesn't seem like a big deal, what happens when it doesn't feel good 1,000 times in a row? Eventually, it's really not going to feel good. It's really going to start to bother you. It's really going to be louder. And then it's not that it's harder to fix at that point, but tuning into them now versus later is ideally how we'd all be in relationship with our bodies. Hi, Sacred Illness listeners, Dr. Erin here. If there's one thing that these interviews on this podcast make clear, it's this. Your illness is not a fluke, it is not a failure, and it is certainly not just physical. There is meaning in illness, there is purpose in our symptoms, and there is a message that your body has been trying to communicate, often for years, and the only reason it's still speaking is because you haven't yet been given the tools to truly listen. That is exactly why I created the Sacred Illness community. This is a space where you can explore the kind of deep somatic work that I do with my one-on-one clients, learning how to decode what your symptoms are actually saying, uncovering the old programs and survival patterns that are keeping you stuck, and taking the steps to release them so that you can embody who your illness is inviting you to become. Because here's the truth. Healing isn't just about managing symptoms. It's about putting illness out of a job. It's about rebuilding trust with your body and remembering that you have an innate capacity to heal, a capacity that has been there all along, just waiting for the right conditions to emerge. In this community, we hold that belief for each other. When you're navigating healing in a way that doesn't fit the conventional mold, it can feel isolating. You need people in your life who see you not as someone who is chronically ill, but as someone who is healing, someone on a journey, someone becoming. That is what this community is. It's a place where you are seen and held and believed in, not in spite of where you are, but because of who you are becoming. If you're ready to stop fighting your body and start listening to it, I invite you to join us. You can go to aurorasomatic.com or click the link in the show notes. And as a thanks for being here, you can use the coupon code PODCAST, that's all caps, PODCAST at checkout to receive 20% off your first month. The path is here when you're ready to walk it. For now, let's get back to the podcast.
I like to think of us as go-karts on a go-kart track with the bumpers around the edge. Our goal is to really make our way around the track, but every time we hit the side, just like in real life, you want to get away from the curb. You want to get back in alignment, and that is really what our bodies want us to do. And we'll hit the curb when we're not quite there. And it's like you say, it's not because you're doing something wrong. You're just not quite going the right direction. And it's just a little clue that this isn't quite the direction for you. You need to just make a little bit of an adjustment. And finding the adjustment isn't always easy, but if you want to search for it, it's well worth it. I realized through my own experience that grief exists practically in everybody because there's something that hasn't turned out the way that we'd hoped for. In older adults, I see that it's not only family members and friends passing away, but it's living a life that they didn't fully get to experience. They didn't get to do all those things that they'd hoped to do. That brings grief into the body. There's us leaving careers or not quite being able to achieve the career that we wanted, or the way that we left the last workplace, it didn't go as well as we'd really hoped. Like lots of things really hold grief in the body. And so I really do feel like every client that comes in on the table is carrying some form of grief. I don't necessarily tell them that, but essentially the body just holds onto those things that have hit us really hard, and we just don't really know what to do with it. So I feel like we all carry a snippet of grief with us, even if we don't feel like we've had the most traumatic event happen.
100%. Yeah, it's for sure. I would say, first of all, 99.99% of the people I work with have chronic illness because of something that happened in childhood. And to me, therefore, that means there's grief automatically because we're not who you needed them to be. Maybe they still aren't, or the safety you needed wasn't there. It's such a prevalent part of our emotional landscape, just as much as joy and anger. So part of healing is learning how to feel your emotions, even know what they are, even know what they feel like, and then figure out how to express them. And part of this work is the part that is so powerful and so healing is that emotions live in the body. They are somatic experiences. It's a feeling, right? Emotions are feelings. And so therefore you have to feel it in your body. And as we were saying before, as you learn what it feels like, what the flavor of it is and how it shows up for you and how it moves through your body, then figure out, what do I need to do today? Do I go to that shop, or do I go for a walk by that river, or do I call that friend, or do I cry, or do I take a nap, or scream to the void, whatever it is for you that day. But that's what we were talking about, just stuckness, blocked energy, right? Is something isn't moving through, something is getting stuck. So this is about figuring out how to get it out. And you had said blocked energy or tight areas of pain. It's not always a physical thing. And can you talk about that? Because I think that's how do you think of that or explain that? Let's say there really is a physical, obviously pregnancy causes the body to move a lot and loosens up ligaments and all that. Let's say also people who have a pulled muscle or a spinal injury or something, like obviously that's a physical thing that could cause pain. But as you and I both know from the work that we do with those parts of the body, there's also emotions there. How would you explain that?
That's a really interesting question. And I think I'm still trying to work that out. The one thing that I do in my consult when someone comes in is I'll say, so how can I help you today? How are you feeling? Is there a part of your body that you're feeling, or are you just feeling tired and heavy? It's one or the other that I feel energy impacts. There's always going to be the band of people who only look for physical events. And then there's a band of people that will really tune into, I just feel really flat and I feel really tired. And that there's that knowing that I know I can feel better. And it's either way, I'll work with whatever they decide they need best. And then it's through doing whatever I'm working on that I get the information about what I feel is holding them back. I have had a couple of clients come in with frozen shoulders. These are older clients. And this is the most interesting part to me because they have had a rich life of experiences, and not all of them have been pretty and wonderful. And one client, particularly, they had a frozen right shoulder, but previous to that, they had a frozen left shoulder. And they're like, I just don't know what I've done. I haven't slept on it funny. I haven't lifted anything heavy. And there's a part of me that thinks there's something more going on here. If both of your shoulders have frozen with no physical ailment to blame, and I'm sure that it is a manifestation of the trauma that just isn't able to be processed. Don't know that it's there, didn't know that it was a trauma, don't know how to process it. There's an array of reasons why it would be sitting there. But I just know, like you say, I don't think I just have this knowing that is because of a build-up of something that hasn't been shifted over time. I don't have the exact reason why. I just know that there is nothing physical that caused that. That's coming from the inside.
Yeah.
And I always relate it back to my son's surgery. I feel guilty saying that I experienced grief from his journey. He's the one that was a patient. He's the one that had the major operation and the life-changing operation at that. Why would I be feeling grief? But the hopelessness I felt, the guilt that I felt as a parent, and not being able to fix it. Really, anything that happens in our life can really have that impact of trauma. And so I was really caught unaware when I realized that I was experiencing grief. It really shocked me. I thought, at least I know how to treat this. I need to be a little bit more forgiving of myself. But I do notice in some older adults, they were not taught to give themselves forgiveness and to tap into emotions. It was just keep moving and get things done and just leave that behind you. And I can't help but think that leaving it behind you has resulted in this buildup that has then physically manifested into a frozen shoulder or whatever it may be.
Yes, that's actually a very helpful way to think of it, because a lot of us, especially as we get older, blame it on age. It's just we're just getting older. So of course my back hurts. Of course my shoulders hurt. Of course my neck, all the things hurt. And I guess maybe, right? But my whole thing is why for some people and not for others? If that was a given part of aging, then we would all have it. Same thing about smoking causing cancer. Obviously, we know it's a risk factor, but if it was the cause, it would be true for every single person who smokes or every single person who eats a certain way or whatever. Things can add to and push us into a certain direction or flip switches on that maybe would not get flipped on. There's still something else. And yeah, I'm the same. I'm still trying to figure this stuff out. Where's that line between it's just physical versus it's whatever? For people who have gone on this journey of trying to get a diagnosis or have done all the right treatment and nothing is working, that's very clearly mind body. If it's not budging in the way that you think it should, and it's been years and years, if it's a chronic thing, that's a mind body, no doubt. And then we start to move into some gray area. The other category is a known injury. If there's an obvious, you got into a car accident or this happened or whatever. But I had a person on my podcast a while now ago, and she got into a bike accident, had a concussion, got a very serious concussion. And so obviously that is a clear injury. But even that injury itself was what she talked about on the podcast. That was her sacred illness. That was her wake up call of you can't keep living the life you're living. She was laid up in bed for a long time recovering from her concussion. And it was during that recovery period that life-changing stuff started happening and she started figuring out who she was. This is my bigger spiritual perspective. We have this reason we're here and this thing we're evolving toward, and life will find its way to get us on that path. That's what I see when I work with people. This is not just XYZ diagnosis. It's not just a concussion. It's not just that. There's intelligence and wisdom here for you if you want to listen to it.
I absolutely agree. And I think while really traumatic experiences put us through hell and back,
Yes.
there are really beautiful gifts that we can receive from these experiences. And for example, myself, I wouldn't have the lens that I look through life with without the experience that my son went through. So it's all these things that sometimes we do have to hit the curb so that we get that moment, take a moment to not sink in, but to let us really take that on And exactly what you were saying, we so commonly want to refer our pain to a physical ailment. It seems to make more sense to us. We can logistically process it better. And I see that all the time with pregnant clients that come in. Some pregnant clients will just say, I've got low back and hip pain, but that's normal because I'm pregnant. Because, of course, your body is expanding and growing and changing at a rapid rate. But not everybody experiences low back and hip pain. But we just allow ourselves to endure the suffering because we just think that's how it is and that's what we should be feeling.
Yes, exactly. And to me, it's empowering information for you to understand how to better connect with yourself and move through something, feel emotions, process something that your body is asking you to process. It's an invitation to get to know yourself better. And the other question I have for you, let's say they are in that mindset of it's just my body, it's just this physical thing, and you're helping them to understand it's this more emotional piece that they're holding.
Yes, it definitely is pushback because, like we said, people aren't ready to take that on. And they might not be ready to take that piece of advice on until later down the track if they
Yep.
do want to take it on. And so I've always taken the perception, and I take it on in my own life, that, okay, I'll go back to my son again. I would never have wanted that experience to happen. And if I could have avoided it, I would have. But because it's happened, I always look, okay, I almost feel as though I have to find the silver lining in this. And this is how I can empower myself. What can I take from this, and how can I use it to propel myself forward? And I just try to use that way of thinking for clients because it is very easy to put blame on situations that have really ruined our trajectory and the way that we really wanted our lives to look. But I've just learned personally that we really just have to look at what is the blessing in this and how can I use that to improve my life and what wisdom can I gain from this, because not everyone's going to get this bit of wisdom. Not everyone's going to have to so what can I do with that packet of information that can help me or others going forward? But like you say, I think it's always going to be an individual thing. And some people will only see it the way they see it. They're not ready to self-reflect, or they're not ready to take it on in another direction. And we just have to respect that some people will want the information and some people will not want to hear it.
Yes, exactly.
Yeah.
I agree with that 100%. And I think it's very beautiful how you're able to look at your relationship with what you went through with your son and his whole journey through that lens. Because I'm the same way. I feel like if I didn't have that perspective, I would feel very lost. Finding meaning in things and believing there's meaning. The events in my life help me feel like there is meaning and purpose to life and meaning and purpose to this journey that I'm on and the people that I'm with and all that kind of thing. And it seems to pan out, right? As we lean into that wisdom and follow those breadcrumbs, it seems to open life up. What you were saying is you went on your journey as you learned how to embody yourself more and trust it more and more, things started to open. And it's that trust muscle. That's part of the challenge is when we are wounded and we're hurt, we tend to not trust that anything could be good or anything could be working in our favor. And so sometimes that's the challenge for bridging that gap between just being in that physical world of like, this is just suffering, this is just pain, to it is pain and suffering, and I can trust that there's something else here. And
Yes.
that's another part that I often get to with my work is people asking about kids who have illness or pain. I would never say it's supposed to be happening to them. They're too young. With adults, it makes sense. We have this whole life we've lived. We have all this stuff we're holding in our bodies. For kids, it's more of a question mark for me. And so I tend to not go into that space. I always say that's where I think we just need to be with the child and support them and love them. But from your experience, you were able to grow and learn and take things from it. So I'm curious, just from someone who went through a journey with your child, is that where you are, where there's not necessarily a purpose to this, but we took from it what we needed to take from it?
Yeah, it's interesting because I don't know that I necessarily have a reasonable thought as to why my son had what he had and why he had to go through what he went through. All I could take from it was what my experience was from it. And I'm not sure if my son will ever be as reflective as I am in his life and to want to know why he was in the situation he was and how it all unfolded. You know, he may never really want to investigate that. But I have found in my own experience that the reason I have come to the perspective that I hold is because I have just always had this want to have my business. And my business, for example, has been the most important thing to me. Of course, my children and my family are important to me, but I have this inner drive that I can't quite explain, that it's very important for me to do the work that I do. And a few things have happened around me that have said, should you just throw it in, Renee? Should you just, it's getting a little bit hard, or it's not showing the results that we really should have for this now. It's making other people's lives around you a little bit difficult. You're starting to stand out and look a bit strange, and you never used to be like that. Is it really worth pushing through and keeping with this job? And something within me just says, don't drop it, whatever you do. This is the most important thing. This is the purpose of my life. And this has made me evolve and self-reflect and learn and take on challenges that previous Renee would have felt, that's too hard, that's awkward, that's going to make me stand out. For someone who doesn't really like to be in the middle of all the attention, my want to do this work has made me push through boundaries that I never would have before. I'm still yet to know why this is so important to me. But I feel for anyone else, if there is something that they really want to get to the bottom of, they will do the soul searching for it. Some people are just not needing to do that in this lifetime, and they are just happy with the way their life is going. So I've had to accept that. Some people in my own family, for example, they don't need the depth of knowledge that I do, but I have to respect that they're happy with what they've got, but I will never be happy.
Yes.
I need more, and I will be continuing searching. I feel like I'm a constant searcher.
Yes.
So I take that into my consideration as well, because like you say, there will be people that don't come with the same perspective that we do.
Beautifully stated. Yes, it's respecting everyone's journey and meeting them where they're at, allowing them to be where they're at. And if anything, that's the whole purpose of life, right? Is just to be alive, to live your life, not the life that
Anyone
we're supposed to live. Yeah.
Yes, I agree with you completely. And I know that the work I do is completely done with love. I am giving you this information not because I want to sound like I know everything and I know more than you about your own body. I am giving it to you because I want to see you live a life that you deserve, and I don't want to see you suffering. And so I always remember when someone walks away from my appointment looking a little bit like, what was that? Or I don't think I'll take that on board. Sometimes I get that feeling. I just sit with the fact that I gave that to them with total 100% love, and what they choose to do with it is completely their choice. But I think if you've got that loving energy behind it, you're doing it for the right purposes.
Yes. It's not about fixing, which is such a hard thing for people to, that's the mindset, right? Is it's a problem that we fix.
Yes.
You said it's about becoming aware of what's important to us on a soul level, and our body reporting back when we don't honor, recognize, or accept it. And again, that's like mic drop, that's everything. But can you tell us about that? Because people who come to you, there's this, I'm coming to you, there's this thing, please fix it. I don't know if this is a conversation you have directly with people, but can you just tell us about trying to shift that mindset?
I have found in my practice, wording is hugely important. People will take offense to how you say things because this is how they perceive it. You are doing this wrong. You need to do this better. And in their minds, they are doing the best they can. They are waking up every morning doing the best they can. So to have someone come in and say, or they perceive you saying that you're doing this wrong, you need to do this better. So the wording that I use is always very careful, because I essentially want to get across that your body has a way it wants to live. And if you don't live in that way, it will start to show signs that it's not happy. And it only wants to live that way because that is your soul's way of living. That is when you're going to be the happiest you could be. You're still going to live life and come across challenges and hurdles and all those things, but you have that feeling within yourself that you are going in the right direction. It's just that feeling you get. So I think I'm just very careful in how I say it, and I always make sure that they leave feeling empowered. So I don't ever like to say that this is a problem for you because they've just had this really beautiful massage. Who wants to leave this beautiful massage with a little bit of piece of paper that says, but by the way, this is what you're doing wrong? So I've always liked to say, like, have you thought about this? And so I'm not directly telling them that they're doing something wrong. And I don't ever believe they're doing something wrong. I can just see that their alignment isn't quite right. I also usually, at the end of my sessions, I always offer them the chance to pull a oracle card. I have a choice of decks at the end of my table, and I say, if you'd like to pull one for wisdom, please bring that deck out and I'll do a card pull with you. And 99% of the time, the card that they pull matches with what I just told them in their treatment. And so it's almost concrete for me that I'm not just making this up. There's something behind this, whether you want to take that with you or not. But the cards that I choose are all supportive cards. I don't cold tarot cards because no one wants the Three of Hearts to be pulled out. So I do make sure that the cards I offer are very compassionate, gentle, and supportive. And if they want to have a conversation around it later, absolutely, I'm willing to have that conversation. But in that moment where they have just rejuvenated their body, it is just critical that I send them on their way with something empowering and something that can help them rather than criticize them.
Yes, beautiful. Yeah, it is. It is tricky wording. We're making the unconscious conscious, and it's unconscious because it was programmed into your body before you had a say over it. You had the resources, the skills, the tools, the capacity, these into our system so early in life. And it's just this thing we're carrying in our body. It's this way of being. It's this way of thinking of life and being in the world that we assume is just normal, who we are. This is how life is, whatever. Again, some of us can have that conscious knowing of, yeah, my childhood was challenging or this happened or whatever, but there's that lack of translation between specifically what the unconscious is holding and therefore translating into the body. And so it's making it conscious, shining a light, saying, this is an opportunity for you to move this up to your consciousness and heal it so that you can step further into who you are and who you're here to be. And then oftentimes the body will then follow because it doesn't have to hold on to anymore. But it doesn't always mean that what we find in our body isn't challenging. Oftentimes it is. It's just that seeing it as an opportunity versus anything about punishment or what's wrong with you. We're all carrying stuff. All of us, like you said, all of us have grief of some kind. All of us have, I would say all of us have trauma of some kind, whether it's a major trauma or a little lowercase t thing. I think of anything our body or our nervous system is carrying is trauma in the sense that it's just, it can't move it through and it needs help. We're all human, and our body will translate that to us as this opportunity to step into who we are.
You hit the nail on the head. The things that you can find in someone's body can be so heavy, and it's not an easy fix. It's not a quick fix. And sometimes people just choose not to fix it because they feel it is easier for them to just continue at the level that they are. They will take the hits that they have to keep the peace. It's just too difficult to take action on what it is. And so I've come to learn that I have to respect that they might not move on that, but they will continue to hold that energy. So it's really just helping them know, okay, so clearly this is an issue for you and you might be very well aware of it and you see it, the pattern, you see it happening in your life often, but it's too risky for you to take action on. So my role then is to help them learn how they can keep it moving so that it just doesn't pile up and then create bigger problems for them. So yeah, it is hard stuff. And I think this is why it's hard to deliver that information, because sometimes we don't want to hear it. We don't want to hear the hard stuff because that's work for us and it's going to be really hard. It might break up households. It might mean divorces. It might mean moving houses, moving overseas. It's big stuff.
Yeah.
And yeah, some of us just don't want to, we just don't want to go near it. And that's okay. It's a personal journey for sure.
Exactly. We ultimately have free will and we can choose to get on the ride if you want and see where it's going to take you. It's deciding what you want your life to be. You get to choose that, and there's no judgment or criticism about that for anyone, because it's not easy work and it's not sunshine and rainbows. If anything, it's challenge and then you get there. So it's not
and it's only worth it when you get to the end of it. But is it what you want? Yes.
Yeah, exactly. Yes. The way
Yes.
I always talk about it like a hero's journey. You watch any epic movie and it's not fun until the very end. That's when the party happens and everyone's celebrating.
That's right.
But
Great
until you get there,
analogy.
yeah.
Great analogy.
A little scary. Yeah. So, oh my goodness.
Yeah.
I feel like we could talk for hours. I think we got through everything or the kind of big notes you sent me. Is there anything that you want to say or share as we're wrapping up? Any other kind of tidbits or insights or pieces we didn't touch on?
I think the question that I've really come to use a lot in my practice is it's not just what have I recently done to cause this discomfort in my body, but how have I felt recently about my life? Am I living the life that I really feel that I should be living? Or how have I emotionally felt about events that have been going on in my life? I think that's really the difference in when I had such trouble coming into being the role of a massage therapist because we were very much taught sports massage and that real quick fix your shoulder so you can get back onto the field, that kind of deep pressure, hammer it out of you and off you go.
Yeah.
And so I really thought, I don't know why I'm here. Why am I in this field? I don't fit. But as I came into my own business and I started doing all my consultations, really what I wanted to know was, how's life been lately? That's the question I want to know. What's been like, as if you're having a cup of coffee with me. So what's been going down in life lately? Not how many marathons have you run? I want to know that too. I want to know how you're using your body. But often we don't get asked about what the emotional state of our lives have been lately. And my purpose is to really bring that to the forefront with my clients, to take that into consideration, not just how have you been sitting at your desk this week and how many times did you get up and walk around while you were seated for 8 hours a day, that sort of thing. I just want to really bring that awareness in because that's all part of starting to learn how you operate.
Yes.
Yeah.
That's a beautiful question too, because it's so gentle and so kind and so inviting and yet gets right into it, right? Like brings up so much immediately, just shifts that perspective out of what have you been up to how have you really felt about it and how is life
Yes.
going for you? Those are just variations of a question that really get into the heart of it. And
Yes.
it reminds me of my mentor used to say, how do you want to live? And so it's like what you're asking is like, how are you living? Basically, what is the quality of your life? How is it feeling?
Yes.
You?
So funny you say that because I'll sit with a mother and I'll say, so how's life been? And they'll be like, oh, we had a birthday party on Saturday and then my in-laws are here and my husband lost his job last week and the fuel prices have gone up. And you think, it's not until someone asks and you start listing what's going on that you're actually hearing what your life has just looked like last week. And now you've got a little bit of an idea of you've been under a lot. You've just been going through the motions because you've got to get your kids ready for school. You've got to go to work. You've got to get the dinners on the table. You just go through the motions, but you haven't actually stopped to realize really what you've tackled this week emotionally. Right. It's huge.
It is. And it shows how good we are at going through the motions, being in our heads and focused out here. But if you actually stop and take a breath, you're like, wow, no wonder my back hurts. No wonder I'm exhausted.
Yes.
No wonder I'm burnt out and exhausted and can't feel anything because if I do, it will completely shut me down. I laugh and I'm like, oh yeah, that sounds pretty true for me now too. I think it's that awareness and the space that you're creating for people to be seen. You're creating a safe space for them to be seen, to be really held in the realness of who they are in that moment. And then that is what opens the doors where their body can then let things move through and be released and then open that door for healing. Yes, such beautiful work. And tell us about where people can find your website, your Instagram, TikTok, etc.
So I do have a website. I am at balancingwomanhood.com.au, primarily with women and through all stages of womanhood. So women who might not have children yet, women who choose not to have children, and then all the cycles of having children, going through grief, children moving out, refinding themselves now that they're at the complete other end of motherhood. I'm based in the city of Adelaide in Halifax Street, and all of the details are on my website. You can book online as well. And I do have socials. I'm mainly on Instagram, but I'm trying to move into TikTok. But I'm not a great dancer.
No,
I've got to find my thing.
Yes, great. Thank you.
Yeah.
And I'll share all of those links down below too for folks who want to find you, schedule with you, or just follow along with your work and your journey. And I know social media is such a love-hate. It's a challenge, but
It is.
yeah, you have so many nuggets of wisdom. So I'm grateful that I get to share them with my audience and to help share this message and show all these different avenues where it's different person, different modality, but same thing, right? Same results, same thing that we're finding in people's bodies and same messages the bodies are sharing. So it doesn't have to be this one path. Find the person that resonates with you.
Yes.
There are many ways for you to come back into your body and understand its messages and to heal. It's just a matter of trusting and finding and feeling safe with that person. So thank you so much for the beautiful work you're doing, for trusting your intuition. Thank you for finding who you're supposed to be in this life, and for the healing work you're doing, the seeds you're planting now, and the seeds people are carrying with them because of you that might be planted later. I'm so grateful to have connected with you. Thank you for sharing your wisdom with us on the podcast today.
Thank you so much. I've loved every bit of it. And I also want to make mention to any of the listeners, please know that even though we are the healers, we are also dealing with these things. So don't think that we've got it all sorted and we know how to live the perfect life.
No.
We have that compassion because we are also going through those motions. And just as we want a better life for ourselves, we want that better life for you. So I always sometimes think that clients must think we just have it all sorted, but we don't. And so that makes us human. And even more, that makes the relationship between the client and the therapist so much better because we're all going through it. Yeah.
Absolutely. For that, I think of it as the wounded healer. If anything, we do what we do because we've been wounded, because we are wounded, because we are healing. We're constantly figuring things out. And I think it's just finding that person who's a little bit further down the path from you because they can help move to that point. But everyone's on the path. There's no end goal. There's no place you arrive at where it's fixed or perfect or whatever. Life is life. We're always going to be journeying and discovering and learning, and absolutely have not perfect, not figured it all out. We're just here to hold space. I think of it as like we're here to hold space for your humanness too. So just find yourself, and we are here holding that space because we know what it means to really just be with yourself in all of our beautiful imperfectness so that we can find out who we are and move toward that.
Absolutely.
Yeah, beautiful way to end that, and just such an important message because yes, no one is perfect. And if they say that, run the other way. So thanks again, Renee. And again, all her links are below to follow her work. And thank you everyone for tuning into another episode of the Sacred Illness Podcast. And we'll see you
next time. Thanks so much for tuning in to another episode of the Sacred Illness Podcast. If you find this information shared here inspirational and educational, please share it with those you think would benefit from this work. To take this work deeper yourself, check out our website, www.aurorasomatic.com, where you can explore our coaching, community, and course options. And don't forget to subscribe to this channel where new content is coming out all the time, intended to inspire, awaken, and help you deepen your relationship with yourself, your life, and your world. We'll see you next time.